Brilliant. Thank you very much, Rachel and Joy. Good afternoon, everyone. Hope you're enjoying the AHP day so far today. My name is Tom James. I'm the Assistant Director of Innovation at Aneurin Bevan University Health Board. I have been in post for about a year now. I'm on secondment from Welsh Government for 2 years. Where I was previously the head of innovation for the Health and Social Services group. So it's good actually to reconnect with some previous colleagues of mine in the allied health professionals network. Ruth Crowder, for example, who's a past colleague, and it's great to talk to you guys on a day where we're celebrating a lot of hard work across the system from allied health professionals amongst a wide range of NHS Wales colleagues. So I'm going to talk to you today about the NHS Wales COVID-19 Innovation and Transformation Study, which I've been leading since around sort of the end of March of this year. This is a piece of work which was, for me, it came off the back of some radically new ways of working that I saw, quite quickly that were taking place. New ways of working, new models of care, new rapidly changing ways in which we were having to provide services to patients, given the COVID-19 pandemic, given the need to work in a different way. And so for me, with lots of new ways of working or changes in ways of working springing up, I thought there was a real need to capture innovative and transformative practice, which, at the right time, I guess, and, maybe now, maybe a little bit later on, but, we need to use this practice to inform scale up, to inform knowledge transfer in the light of these rapidly altered and changed ways of working, and this actually directly speaks to a number of different policy aims. I mean, a healthier Wales, the Welsh Government's plan, a long-term plan for health and social care, talks about scaling up innovation to regional and national levels through evidence collation and sharing across multiple networks. It directly talks to the Wellbeing of Future Generations Act and the Sustainable Development Principles of integration, collaboration and involvement. It directly talks to, NHS Wales University Health Boards and the criteria for University Health Boards around research, supporting research into applied innovation, and it directly talks to the requirements of the NHS Wales planning framework around innovation. So actually, a lot of innovation will come from identifying good practice from elsewhere, but enabling the mechanisms to support the adoption of innovation at pace and scale. So just to get back into the detail of the study, so the innovation, the COVID-19 Innovation and Transformation Study is led by Aneurin Bevan University Health Board. However, what it has evolved into is a multi-organisational pan-Wales collaboration that has captured a novel and innovative practice emerging as a result of changed COVID-19 practice from now every NHS Wales organisation. We are working quite closely with Welsh Government, the Transformation and Innovation team there, all of our partners across NHS Wales, particularly through the NHS Wales Innovation Leads Network, of which I am the Aneurin Bevan member, but it's essentially my equivalent to in every health board, have helped to push the study out right across the whole of the system in Wales. We've had support from partners such as the Bevan Commission, the Welsh Confederation, the Welsh NHS Wales Confederation, academic partners, Medi Wales, Life Sciences Hub Wales, and I guess particularly relevant to today, the Allied Health Professionals Programme and the Healthcare Scientist Programme. So actually, I mean, what has the study? Who have we spoken to? Well, the study has, I guess, uniquely collated a very significant range of evidence on innovative and transformative practice from and executive directors, administrators, surgeons, consultants, innovation leads, research directors, clinicians, health professionals. We've got a huge range of different types of people who've answered and participated in the study. And I guess what that means is that we've got different views from very different cross sections of the system here in Wales. And actually, the more people that we can engage with, the more the more different views we get, the better picture we get of what good stuff has happened. And we kept the study deliberately simple in this regard. What good stuff has happened out there? What innovative or transformative or different stuff have you have participants noticed? But also what stuff hasn't worked quite so well? How do we capture the learning about things that we might do differently in the future? And actually bringing that evidence back now into Aneurin, Bevan. I mean, the study is still live, and what I'll ask everyone, what I'll ask the organisers to do actually is to circulate the innovation study to anyone who hasn't done it yet. We have had some specific responses from AHPs and healthcare scientists, but it would be great to pick up some further views on the study, which is still open. So what I'll do, I will get Joy and Rachel to circulate the study link to participants after my session. And if you would mind filling it in, we're reasonably soon we'll be having an independent report produced on the evidence through funding through Welsh Government and others. So it'd be great to get your views on that. Just a quick plug before we get into a little bit more detail. But okay, so what we've done with some of the evidence so far internally with Aneurin, Bevan so far is we've linked it up with some other studies that we've done internally around agile working and well-being, and what we've done, we've incorporated that learning, the high level distillation of that learning. You know, the detailed work is still yet to be done on that. But what we've got is an executive level strategic change, innovation and organisational development programme, which we will be incorporating through a range of different mechanisms. But actually what we've got, so we've got a top-down approach which is looking to apply evidence, but we've also got a bottom-up approach. So I guess probably one of the key themes that we picked up from the survey is that what COVID meant was that people were willing to look at the ways in which they work in different ways. So they were willing to look at how they provided services to patients in a different way. And I think what that means is with big periods of change come times, you know, where people are willing to do something different and to try something different. So actually what we've put in place in Aneurin, Bevan is a bottom-up piece of work now, where we're providing innovation and transformation training to specific members of staff who have requested it, with a view to rolling that out further. So let's get into some of the key themes that the innovation and transformation study has picked up. So I'm not going to, as I've said, you know, we've had a fairly high level analysis of the report of key themes coming out of what is a very, very qualitative sort of evidence base at the moment. And some of the key things that we've picked out are a much greater use of technology that was probably already available, that we weren't utilising to its full potential. You know, for example, attend anywhere, phone consultations, use of Microsoft Teams, Skype. We had these things already, but we probably didn't use them to their fullest potential. I think the next big theme was there was very much people have been reporting an inherent trust provided to them by management executive teams to just get on with and do and work in these new ways as people saw it best to do so. So it was left to clinicians clinicians who were working predominantly in non-COVID non-COVID areas of the hospital, who were providing services that would have been there beforehand, to provide those services in the way that in the best way that they or the way that they felt was best. And there was an inherent trust for people to just kind of get on and do that, which pointed to, in turn, a reduction in sort of or an alteration of what would be normal governance arrangements, and a reduction, you know, people saying that there was a real reduction in the amount of bureaucracy and layers of management or decision making that they would normally have to do. People reporting very much off the back of that the pace and autonomy of decision making also improved much more quickly, perhaps because there were less layers to go through, or the layers had been removed. We know that with the increase in the amount of technology, the greater use of technology that was already available, we know that there has been quite a significant reduction in travel, staff travel, particularly for work, to go to meetings, but also for patients having to travel. So some of the data that we have, just from an Aneurin Bevan perspective, and these are average figures. I mean, it's very difficult to work out to the pound, what the travel and subsistence savings were. But we believe in Aneurin Bevan that, since March, we've saved an average of £50,000 a calendar month on TNS, which means that we've saved something in the order of £350,000 to £400,000 since March, which is not an insignificant sum. Actually, if you turn that into the amount of miles that have been saved, that's actually 777,000 miles as an average, of course. 777,000 miles of staff travel saved since March. When you work that out as an average of how much CO2 that has released into the atmosphere, that is that is a saving of around 217,000 kilograms of CO2 that we have not released into the atmosphere as a result of staff travel. In terms of patient benefit, so in May, for example, Aneurin Bevan undertook 3,009 new non-face-to-face consultations and 10,013 follow-up consultations using technology. And what that meant was that was, first of all, a 133% increase in non-face-to-face consultations, but that actually, in terms of increase of follow-up consultations, that's a 358% increase of follow-up consultations that weren't undertaken face-to-face. This, if you upscale that into patient journeys, that means that over a 6-month period, that saves 58,729 patient car journeys, which is a huge amount. And actually, then, if you think about Aneurin Bevan as an approximately 20% of NHS, of the total of NHS Wales, you start to think about the application of this learning across Wales would then mean about £250,000 a calendar month on TNS across NHS Wales. It would mean 6.66 million miles saved per annum. It would mean 1.866 million kilograms of CO2 saved in the atmosphere, or in a slightly different way, in terms of patient car journeys, it would save 293,645 patient car journeys to Welsh hospitals over 6 months. So you can start to see, actually, just how significant the impact of the NHS is, in terms of the environment as well. Just bring it back now to some of the other themes that have picked out of the survey. I'll probably go for about another 5 minutes, and then we can take some questions. I think it's probably highlighted, that I guess what we've talked about here is a lot of the non-COVID stuff. In terms of the COVID or the people who've been directly responding to patients, I think the staff well-being has been a real issue. It has been something that has been brought to the fore, and I guess certainly we felt here in Aneurin Bevan that staff well-being has been taken more importantly, and the need to ensure our staff well-being is being taken more seriously. And there's a programme of work being undertaken to look at how we can really enable our staff to be as well, support their well-being as best as possible. It's certainly enabled a much more flexible workforce model, where people, are able to work from home more often, which means less traffic on the roads, which means they're able to kind of do some of the things like pick kids up from school, all those, kid clubs, all those, all those parts of life, a work-life balance. I think there've been definite improvements as to that. And I guess coming from Welsh Government to the NHS, I certainly felt that working from home in the NHS wasn't something that was more of a routine thing, whereas it was easier to do so with my previous employer. So We've talked a little bit about some of the key themes of the study. We've talked about the evidence of some of the impact. I haven't gone into some of the full details of that. I don't think we've got time today. But actually, just in terms of the forward look, so where do we want to go with this next? We have a huge evidence base. We're still collecting a huge evidence base from the study, and I guess, you know, if I'm able to circulate the study link to you guys, and you guys are able to put some further evidence in, that is only going to broaden the evidence base that we've got to support learning, to support knowledge transfer, and the upscale of innovative and transformative practice right across the NHS in Wales. We have tendering at the moment for an independent report to be produced on the evidence, which will be, you know, a formal report will be produced, and that will be circulated to excuse me, sorry. That will be circulated at a number of different levels, not just at, you know, AHP or healthcare professional, you know, networks, but also, you know, amongst the NHS Wales chief executives, you know, amongst innovation leads such as myself, a whole range of different types of clinical and non-clinical networks. Will, you know, we will make sure that the report is available right across Wales for people to use it as best we can. That's probably as much as I was going to say, really, in terms of the NHS Wales Innovation Study. More than happy to take any questions if people have got any. I haven't seen any pop up in the chat as yet. That may be because it's the after lunchtime session. It may be because I've answered them all already. I suspect it's maybe somewhere between the two, but I'll stop talking for a little while there and give anyone a chance to ask any questions that they have. There will be a formal report issued on this, and that will be coming out, I guess, sometime in the new year. If there is nothing further, oh, here we go. There's a question come through. AC, what might be the impact for tertiary services? The honest answer is I don't know. I guess what that probably means is that or what that question leads me to is that in the actual the detailed analysis of the qualitative evidence that the report will have produced, and that whoever tenders successfully for the report will get, is that's the sort of detail we'll get into as we go through that. I'm not I'm not a healthcare professional myself, so that kind of level of detail isn't something that I've got a full grasp on. I guess what I'm probably concerned with is getting it out across the system as far and as wide as we can. To create this evidence base, in that we can drill down further, or people who are much more knowledgeable than myself can drill down and get into. But what I'll happily feed that question into the people who did the report, so that we can drill down to that as more of a theme. Okay, well, if there's no other questions, oh, here we go. Big savings to be made on patient travel, I suspect. Thank you. Yeah, absolutely. I mean, I think just to kind of add to that point a little bit, I mean, it would be great if we were able to collate that data at a national level, because the NHS has a significant impact, is a significant part of the public sector in Wales. It is, and I guess certainly even by quoting some of the figures that I've quoted to you today, we can have a big impact not just on the economy but on the environment as well. And I think it's really important to be able to measure the reductions in carbon emissions that the NHS will that the NHS can be directly responsible for. Question just come through here, Joanne. In future, will you be looking to gather data from patients for their experience? Yes, I absolutely agree with that. We do need to do that. It's, I guess, in a perfect world with an unlimited budget, that's the sort of thing that I would want to do more of. Is to kind of see it from the other side. in a way, we are reflecting some data from patients, but it's reflected through the lens of healthcare professionals and healthcare staff. So it isn't quite from the horse's mouth, or as from the horse's mouth as we would want it to be. But I think that's a really, really good point, and something that we'd want to pick up on further. Any other further questions? No? Okay. Well, I will sign off at this point. A big thank you to Joy and Rachel and the AHP team for allowing me to speak to you guys today. I hope you found it informative. I'm on the NHS Wales distribution of business. If anyone wants to drop me a line on thomas.james3, please do so. It'd be good to have your experiences. And just again, one more shameless plug, if you guys could fill in the study, that would be great. I'll get it, in actual fact, I'll get it sent through from Rachel and Joy. Enjoy the rest of your day, guys. Thank you very much.